Who responds to your building for like emergencies?
Me.
You guys do first aids and stuff like that as
Yeah.
well, right? Just the basic first aid container that I gave you?
Yeah.
Alright, we got 3 people.
But they also would have.
Okay, so our training today is going to be on skin and skin tears, bruises, abrasions, just the first aid. Okay, and this is going to be probably like 50 to 1 minute of training. But I'm going to go over some of the supplies that you might be able to use when somebody falls down, has a skin tears, or if we can abrasive, how to clean it, properly. But just real quickly, I'm going to go over like just the basic of the skin. It's got 3 layers, right? There's the epidermis, and the epidermis has 5 layers on top of it. Basically, the very top layers of your skin, when you're scratching that off, the dead tissue, those are all the upper layers, and there's 5 of those layers. Okay, once you pass the first layer, you have the dermis, and then you have the dermis that's underneath, and then you have bone that's underneath that. Each location is different. Like for example, if you put pressure on your butt, right, because there's a lot of tissue there, that might take a long time to get to the bottom of the subcutaneous, which is the fat layers, right? In comparison to like coccyx, right? Your coccyx, like if you're laying on your coccyx right here, right in your tailbone, there's hardly any meat in there. So like if the top layer is gone, that's almost like a stage 3. You know what I mean? Like so, we stage pressure based on what layer is gone. So the top layer will be stage 1. We're not gonna go over the layers because on the staging, because you don't really need to know that. But it's just I want you guys to feel comfortable when there's an emergency and somebody's bleeding. You're gonna be like, okay, this is what I need to do. Okay. So let's take a look at real quick. If somebody falls down and starts to bleed out, what do you think is the most important thing we need to do?
Pressure.
Pressure, right? Let's just say I'm Mr. Brown. I fall down and
To find out where is the bone first. Because you can see the bit, but you don't know where it is coming from.
Okay, so let's just say I'm bleeding from my head, right? The first thing you do is figure out where the bleeding is at, right? But yeah, pressure should be the #1 thing that you should be looking at. And if all you have is this right here, guys, if all you have is right here, don't worry about cleaning anything at the moment because you have a lot of blood. You want to put pressure on there. Use some gauze, right? Put some gauze in there, and then wrap it up like Erlex. And then the second there, you can even secure it with this right here. Okay, if you don't have any of this, guys, put some gauze in there, something clean, and then wrap it up with a towel real tight. Okay, and so until it helps around. Because if in this environment, if somebody falls out and their hands are bleeding, you're gonna call 911, right? Is that the protocol, right? So if you're gonna call 911 anyway, just make sure that they stop. You stop the bleeding. Okay, so that's pretty simple. You guys know that already. Okay. Let's go over some of the things that are not simple, right? Let's, for example, I'm walking around and then I scrape my hand, and then now I have a skin hanging, right? I have a skin hanging. You don't see a bone. This is called, and then you can see like the blood, and you can see like tissue, right? So I'm gonna draw this out right over here. So you have your arm right here, right? This is your arm, and then this part right here. This part right here is open, right? And this is a piece of tissue, and it's still hanging, right? It's still hanging. But what you want to do is obviously stop the bleeding, right? Use this right here. The best solution you can use for cleaning a wound is normal saline, because this has the same pH balance and the same amount of sodium that's in your blood, right? So if you have something that has issues with edema, if you give them like just regular solution, they might have more swelling or vice versa, right? So these right here actually have the same balance as your plasma in your blood. So always have this handy. You don't have to have the special wound cleanser that they say, but this is the best one you can use here in assisted living, right? What you want to do is stop the bleeding, put pressure on it. That blood should stop. If it doesn't, continue to apply pressure for a few minutes until you stop the bleeding, right? You don't necessarily want to take that flap and just close it and cover it, because if you scrape it like this and it's kind of hanging and it's grinding it everywhere, there could be some bacteria and everything else that's already on there. So what you want to do is you want to take that flap out, right? You can use this right here, or you can use a scissor. Clean the scissor with alcohol, right? Clean with alcohol. Take the scissor, flip it out, and then you can squirt all around the wound, squirt all around the flap, and then dry it off with some gauze, right? What you're doing is you're getting those bacteria out. So this will heal so long as there's no bacteria in there. But if you close it over and there's bacteria in there, it's going to be red, and there's a lot of potential for infection. Okay, this patient, and most of the time it doesn't. Most of the time, but you just put your resident at a high risk if you don't clean it out. Okay, you close it, and then after you clean and close the flap, you want to dab it again to stop the bleeding. This is going to continue to bleed, right? One of the best things about the stairs, these are pretty expensive, but these are really efficient when it comes done. And I'll show you how to use this the other day. But what you can do is you can actually cut this in half. If the wound is pretty small, right? The cut is like this, right? It's pretty small. You don't have to put this whole thing in there. You know, you can cut it. Right? But the most important thing is that when you're putting this on, is that so when you're putting this on, make sure that you're putting it like that. And then the next one, you want to try to put it as close to it as possible. You put a little gap in there. The most important thing with this is that you want to keep it nice and close. What's good with this is that unless they have edema and it's like weeping, right? If it's a good tissue like our tissue, some of your residents don't really have edema. But if it's in the arm, it's not really weeping. You can close this all the way through, right? Put another stair strips in there. Nice and approximated, okay? You can just leave it like that, right? You can leave it like that, you can monitor it for a few days, right? But essentially, this is gonna heal. This is gonna come off during the shower or something like that, and it's gonna heal, and it's gonna heal nicely. If you put little gaps in here, some of these tissue can go out and bleed, and blood can seep out of there, and it'll start to bulk up, and that blood can dry underneath it. Now you have a bubble underneath it. Like for example, if you do this right here, right? If you do that right there, because you're in a hurry or whatever, things can go in there, blood can come out, and there's not enough pressure there. You know what I mean? Bacteria can go in there. So with this right here, you don't need to put. You could. Let's just say that your resident is confused and she might scratch it off. Just put something like
Band-Aid or something?
like a foam like this to try to cover this, but you don't want to put anything sticky on there. For example, you don't want to put where did it go? This short side right here, where like you can see it's very sticky. It goes in there because when that short side comes off, you'll rip that stair strips off. This is designed to come off on its own. So put them on, leave it on, monitor. It's the best thing for skin tear. Okay? Skin tear. This is not abrasion. If I walk around and I scrape it like this and now the tissue's gone and there's no cover there, you don't want to use this. This is not something we can use. Okay? So in that situation, so anybody have any questions on how to use stair strips?
No.
Okay. And again, you can cut this in half if it's a smaller skin tear like that. But that should be like this. Okay? It should be nice and flat right there. It should be approximated. Okay? So, and then it'll heal on its own. And there's very little, if any, pathogens that will go in there. And it prevents bleeding as well. Right? And it's a nice look. It's a nice look when somebody has a skin tear. Now, same situation, except this time is the skin is gone. This you just have an open area that is just bleeding, right? And this is fresh. You came up and it's a fresh incident. The resin bumped into the wall and there's no tissues and bleeding. Same thing. You want to clean it. You want to nicely. You move everything that's on there. Squirt this saline. The best thing you can do is just squirt it. And your first aid should be pretty quick anyway, right? When you go in, you have a lot of things. You have to pass meds. And you should be comfortable looking at these. Squirt it, dab it, dry it off. And then what you can do, if you have this is called a top dressing. I don't know if you guys seen this. Okay? This is a top dressing. And if you don't have this, that's totally fine, okay? This is called a top dressing, it's called oil emulsion. Sometimes it doesn't have oil on it, okay? Sometimes it doesn't have oil on it. But you don't use this in here?
Yeah, we do, but ours is yellow.
Okay, that's the same thing. That's the same thing. This is in regard to something that's open like this, and the skin is gone. It's called a top dressing, and you can put that right on top of it. You can put it right on top of it after you clean it. Okay, so what happens next is if you decide to change it every 2 days, 3 days, with wounds, guys, you don't want to change it every day anyway, you know? Because the wound, what happens is that when this heals, it heals from side to side. And then tissue starts to grow and floats into moisture. So if this will add a little bit of moisture on here, and new tissue will glide over and heal over that wound. Okay? If you're changing it every day, and you're rubbing, you're squirting, you're rubbing, it's gonna heal very slow. Okay? So you leave this on. You don't even have to add stuff on there if it's nice and moist. It has to be nice and moist, right? You know, you guys are very limited in what you can put in here. You can even put to keep it nice and moist. Let's just say you change it every 3 days, right? You put this on top, and then if it's a dry tissue, like a dry skin, which your resident has poor circulation, and there's not enough on there, you're not gonna have that wound heal if it's dry. So that's the thing. If it's dry, you add something moisture. And Neosporin works really well, not because it's antibiotic or whatever special ingredient. It works well because you're adding moisture on there. That's the only reason why. Okay. Yes, it prevents a little bit of infection in there, but to tell the truth, you don't put nothing in here anyway. It heals really fast, right? Neosporin actually, if you put it, let's just say you change it in 4 days, you put it on top. You put the Neosporin on top because if the patient is dry and there's nothing on there to keep it, you know, from the tissue from moving. And then you cover it with this foam dressing right here, right? Make sure it's covered. Change it every 3 days. That keeps the temperature nice and warm, the same temperature that's inside your tissue, right? And you're preventing the ripping. If you rip this dressing off, you're ripping the good tissue off. So that's the thing. Change it every 3 days, keep it nice and moist, add Neosporin in there. That dry wound is going to heal nicely. Now,
even if they take showers,
what's that?
Even if they take showers, we change it everything.
If they take showers, you cover it with a bag or something.
Okay.
Yeah. Just say you cover it or maybe prevent it from getting wet. At least for the next 10 days, right? They can do, they can put the arm out like this, they can cover the legs or whatever with a plastic bag. But try to keep this dry, clean and dry, you know? And so once you see some kind of healing in there, then you can start taking a shower, okay? Now the same wound, right? Same wound, let's just say a week later, it's because he has edema, right? He's got a lot of swelling. And this wound is not gonna heal if there's too much moisture, because now it's really saturated. So in that situation, you have to change it every day. Because there's too much, right? And you let's just say you put this on here, and a day later, you're like, change it every 3 days. But because he's got swelling, you put it on here, and you're not gonna know this initially. But you might if you know that he's got swelling. It's like, there's no way. If he's got all that water in his leg and you open it up, that wound is gonna be draining, okay? If you put this in here, and a day later, this is soaked, that's called a strike through. That means that this wound right here with the foam, and this foam right here is so it can soak up a little bit of drainage. That means it's not healing because there's too much moisture in there, and then the new tissue just floating around. Okay, so that means change it daily. Okay, so if you change it daily, and then now it's getting more dry, then you can say, okay, let's change it every 2 days or 3 days. Right? We're getting into the weeds, but the most important thing is that if a couple days later you did your wounds and it's draining too much, make sure you're changing it more frequently. Okay, or you can add more foam in here. I don't know if you guys ever have that in here or not. There's certain things in here that you can put. You can put more gauze in there on top of this foam dressing. If you put this gauze in here on top of it, let's say you put this right here, right? And then there's nothing here. Just throw this out. You put that in there, and then you put that on top, and it's a dry wound. This is gonna stick. It's gonna be so painful later on. And if you do make that mistake, don't worry. Get it wet first. Get it wet first. Let it sit around a little bit, and then you can take it off. Okay.
Or use the non-sticky pad.
What's that?
A non-sticky pad.
Non-sticky pad? Non-stick pad? Yeah, you can put a non-stick pad in here, but still, if it's a dry wound, that non-stick pad might still stick to that tissue, right? Even though, because here's the thing with non-stick pad. Non-stick pad means it's the same as this, it's not sticky, right? But still, if it's a dry wound, you're not gonna be able to get that off, right? The trick to a dry wound is, like I said, if you don't have this available, put Neosporin in there. Put Neosporin in there. Keep it nice and moist, and then you can put some whatever gauze you want on there and cover it. Okay. Just remember, dry wound. You want to put anything on top of it. Later on, you have a hard time ripping that off. Okay. You're gonna have a hard time. So put Neosporin in there. Keep it nice and moist, and then change it every few days. Okay. It'll heal up. Okay. If somebody, what other situations you guys run into in terms of patient falling down? If you have somebody that has a blister, what do you do with a blister? Right? Somebody, you passing your meds and you're like, damn, you got a big blister right here. Right? So, in those situations, the best dressing you can use is the window dressing. Okay? So it could be from friction. You rub your skin too much like this, and it's moist or whatever. You might have some blistering, or it could be some form of like fungal infection, right? That's irritation, and then now you have blisters on there. So it could be many reasons. Medication causes too, but this comes in a bigger form, right? This right here is called a window dressing, right? And if you put this on here, there's a little plastic right there. You can see everything underneath it. You see that? This comes in bigger. You guys seen this before, right?
Yeah.
It comes in bigger form. This is great for blisters. You leave it there, and you leave it there for 7 days, and then when it pops, it literally goes like that. And then now you can take this off. You can take that off. 7 days later, it's popped. Or whenever it pops, you leave it on there, put an order that says, film dressing or blister, remove when it pops, right? So it's there for 7 days. Now it's like blood, you see it and it's popped. So it catches all that, right? You remove it, you clean it. It's a nice, still an open area, right? So you want to dab it, clean it off, and then you just want to put like a band-aid on there or whatever you need to. Or one of these foam dressing, right? Because literally a blister, it's not as big as this full thickness right here where it's gone underneath the dermis. Okay, so blister is pretty superficial. Once that pops, it's you can literally just put a band-aid on there. Okay. Hematoma, anything that's the resident bumped their leg on here, and then now they have a ball. Have you ever seen that? It's red, and it's like punching out. And you're like, what am I gonna do with this? You don't do anything with that. You just monitor it. Okay. If you have a patient that's like always bumping it, and you feel like, hey, my bumping might squirt, fluid everywhere. You can cover it with this Curlix, right? You can wrap Curlix around it, loosely, right? So this will help kind of protect some of that, okay? The other thing is the tape. The tape is great for patients that have fragile skin. How do we know a patient has fragile skin? When they're shiny, right? When they're shiny, they're really like tight. They're bruising already that's on there. They're cachectic, that means they're very skinny. Or they have a lot of edema, right? So how many tapes do you think there are out there? Have you guys seen this paper tape before?
Yeah.
You guys use this or you guys use a different tape?
We use that one in a different one.
There is another tape out there,
Yeah.
right? So this is really friendly, right? This tape right here, have this available for your residents, especially in this environment where residents are frail already. If you're dehydrated, your skin needs water, right, to be efficient, right? But a lot of residents don't drink water. They take medications that thins out their blood, so they're high risk. If you put this really sticky tape that's on there, right, even the foam dressing, right, that could rip your tissue off, right? So use this paper tape. So if you have to use this curling, you wrap it around, or if you have a non-stick pad, it's not sticking, use a paper tape for residents that have fragile skin. Again, when patients that have fragile skin, when they're shiny, there's no hair. Right? In their legs, there's no hair because there's no circulation, right? There's no hair. So it's shiny, same thing, that the circulation has gone down. So you can literally look at a resident and be like, look at that. Look at your skin, your legs, there's no hair, it's shiny. That means there's no circulation. That means that the artery is no longer working as good, right? So these residents will have, those are the residents with dry wound. They have wounds that get dry. Why? Because there's no more circulation, right? So residents that has edema though, there's edema, their legs are fat, and they might still have hair, but those are the ones that have issues with lymphatic, where they can't bring the water back. Okay, and those residents, when they open up their wounds, they're gonna have draining wounds. Those are the ones that need to have foam in and change the dressing daily. Okay.
For that one, you call, don't they do like a, kind of like a, I forgot the name of it, but it's like old school, it's like they wrap them.
Yeah, so I don't want you guys to wrap here because we do wrapping in skilled nursing, okay? But once you start wrapping the residents' legs, okay, especially in this environment, it's fine if we wrap our legs, we're young, we have nice circulation still. You do wanna, wrapping means that you're wrapping the legs to squeeze the fluids up. The fluids goes up, goes to your bladder, goes to the kidney, you pee it out. Right? The problem is with residents, when you start squeezing their legs like that, they might not have good circulation already. So when you start squeezing it, you're gonna kill the circulation even more, you can kill the whole leg. Okay, there's a very specific order before you start wrapping your residents' legs. And you don't wanna do it here, because when we do wrapping legs in skilled nursing, I have to take the blood pressure here and here, and to monitor, I have to get a specific number above 1 in order for me to say, okay, we can wrap that leg. So I gotta have a specific, that tells me, oh, there's good circulation on there, right? Or sometimes they even do like a view of the leg to make sure that there's a good circulation. So wrapping is good. Here, what you can do though, when somebody has edema, is you can just raise it up. When you raise the leg up above the heart though, right? When you're laying down in bed, you raise it up. So now, it's not just raising it up like this, you know, fine watching TV. No, when you're laying in bed, make sure it's above the heart. That fluid goes up, all the way up to the heart, and then back to the kidney and you pee that. Okay, so that's the best way to get rid of edema, is to raise your legs up above your heart. Not just when you're sitting down. A lot of us ask, yeah, I'm raising my legs, it's not working. No, because you're sitting down watching TV and still, your heart's right here, your leg's right here. You raise it up like this, but that's not gonna work. You know what I mean? So, what other concerns you guys have? Vitamin D. Vitamin D is really, really good for patients that have really dry skin too. Okay, our goal here as med techs, as nurses, is really to prevent skin tears and bruising. And how do you do that? Increase moisture, right? This right here, vitamin D, it locks in moisture, right? In comparison to like a lotion. Lotion, it gives you moisturizer for like a minute. This right here will give you moisture for a long time. It just locks it in because it's emollients, right? So these are the best preventative measure you can put on your residents' legs or arms if they're dry. Okay? But Eucerin too, cream, right? So you have assisted living, you have creams, and then you have these vitamin A and D, which is these are cheap but really, really good in terms of residents that are dry.
I have when you have a resident that has like rashes and then they open.
Yeah.
Do you still use a camel set?
Okay, so to use a combo set, you guys use combo set in here?
Yes.
Okay, so the barrier cream. So make sure the barrier are for tissues that are unopened. Okay, and then let me show this one. So you guys can understand. But sometimes nurses get this mixed up in skilled nursing too. So here's your top layers of your skin. Okay? Here's the second. And then here's the bottom right here. Okay? You might have rashes over here. Okay? That's fine. You can add your whatever.
When would you use A and D or
Same thing.
or
When the tissue becomes open, like this right here, like when it's an abrasion is bleeding, you shouldn't be using these. What do you call it? The calmo.
Yeah.
The calmo is for something that's for the top layers. Okay, if it's affected.
Nothing opened.
Yeah, nothing open. Okay, so
Just redness.
yeah. So if you have something that's open, guys, it's really important because our nurses do this the same thing too. Is that, oh yeah, you had a rash and now it's like open, it's gaped up. Yeah, you still have a rash all around it, but now you have something that's open, right? It's stage 2, right? Meaning it's a full thickness. Anything that's full thickness, right, that's gone into the dermis, right? You can't put these things on there. Okay, that means you have to cover it. So if you have a bunch of here's your arm again, right? Or here's your butt, here's your bottom right here. You have a bunch of rashes right here, and then you have an open area full thickness right here. You can put the camo here, you have to cover this. It's really important. If somebody has that open area, the main reason they have that open area is pressure. You can heal, you can put $1,000 dressing on here, and you're not going to heal it if all you're doing is laying this patient in bed. You can heal that by removing the pressure. You can heal this, secondly, by removing the moisture, which is incontinence peeing, right? So you tell your caregiver to change it more often and keep them off of that side. If you do keep them here because you're turning left, right, and in the middle, just keep them on there a maximum of 1 hour and then turn them back. You know, and that'll heal a lot faster. That camo right here to the rashes and the open area, you can cover it, right? But we don't put camo something or anything that's, you know, like a full thickness, right? It starts to bleed out. Now you have an open sore or wound. We can't use those. Okay. Rashes, fine. Little rashes, you know, but it starts to open out and bleed out. I would stay away from that. Okay. Okay. Good question. What are the other concerns that you guys have in terms of treatments? What treatments do you guys use here?
As far as wounds?
Yeah, as far as wounds or anything in terms of like, if you run into an issue where there's an emergency, and what are some of the things that you run into that you like?
Skin tears, basically.
The skin tears, right? Yeah, you get a lot of skin tears.
Yeah.
Yeah. So just that's the most important part is to make sure that this is approximated. Okay, make sure you're cleaning it. Okay. The alcohol you can rub around it too, right? Before you put this, let's just say this is your skin tear hair abrasion, rub the alcohol around it, and then you can put this stitch shirts. What the alcohol does is it makes it even more stickier, right? So but it kills all of the pathogens around it, so it decreases the chances of infection. Okay, but you don't know it, your skin protects you from anything and everything that goes in, right? But anything can come in there if it's open. You can get fungal, viruses, bacteria on there. And that's how you get these infections. Okay, so it's just really important to kind of clean it off. You know, use alcohol and whatnot. Okay, foam dressing. How do you use this foam dressing? How do you know when to use this? Right. So this one right here is actually if you take a look at passes around, this is a little bit more expensive than your regular Optifoam. This is the gentle Optifoam. As you can see, feel that. It comes off your tissue. If you put this in here, it comes off nicely, right? So this is called the gentle Optifoam. If you order these are great for patients that have
thin skin.
Yeah. Right? Because you've seen the other Optifoam, right? They're really sticky.
Yeah.
You take them off and they're ripping tissue off.
Oh, yeah.
You know, so this is called Optifoam Gentle, but they also come in like extra absorbent. So this would be somebody who has, again, this is not for protection. This foam right here is for, a lot of nurses think, oh yeah, I'll put that in there because he has pressure, so to prevent it from. It has nothing to do with cushion. It has everything to do with moisture. Okay, to soak up the moisture.
I have a
Okay,
question.
you've got a lot of drainage.
We had a resident here that we were using that because she had a open wound on her bottom, and they were using like a strip. But it was thick, but as soon as you get it wet and put it on that area, it would turn into like a gel kind of.
Yeah.
And
So-
we were doing that.
Yeah, so there is a, and I know that you guys do that in here as well. There is a, it's called calcium alginate. So if you have somebody, then you want to do that, right? Let's just say, what is this? Okay, so you have, this is the same thing here. This is the bottom right here.
It's a thick foam, right? And then as soon as you get it,
They come in different, form. So this is your bottom right here, right?
yeah.
Okay, it's bottom right here. You have a huge hole right here. And it's dry. And it's dry, right? The only reason why you're using that to make a nice gel to it is because this area is not wet enough to heal this wound. So what we want to do is we want to put alginate in there, right? Alginate is calcium alginate that like basically sucks up moisture, right? So and why you say, well, it's only dry. Why do you want to put calcium alginate in there? because calcium alginate is actually for wet wounds. You put it in there to like suck it up and then you cover it. So it turns into a gel though. But calcium alginate for a dry wound, you put it in there and then you add moisture in there, which is anthracite gel, right? You squirt a lot of it in there and then you put it in there and it turns into a gel. And then you cover it. And then you keep it there for a couple days. What that does is that, again, it creates, what does it create? Moisture.
Yeah.
So now these little new tissue from the side is going to migrate towards, and then close up. It goes from side to side. These new tissue is going to migrate from here. Okay? But you need that moisture. You're not going to do it if it's dry. And then they meet up, and then they close up. Right? So that's how it works. But it's called calcium alginate, and they also call it calcium alginate with silver. If you have something here that looks infected, right, and if it's infected, it's probably draining. So you put calcium alginate, and this time it's calcium alginate with silver. It's called AG, calcium alginate. It'll say AG on there, okay? Just like EX here, except it'll say AG, and that's silver. Silver has antibacterial on it. So you put that in there because it's probably draining, it's infected. You don't need to add moisture on there because it's already draining. Alright, so you put them on there and then it prevents, or you can use silver too just to prevent from getting infected. But silver, remember, silver only works for 7 days. After 7 days, you don't want to use that too long. And so it's either to prevent an infection or to fight off an infection. And if it doesn't work, then you go to a different treatment. Okay? You guys deal with some wounds like that in there? Hospice does, or you guys do?
Hospice comes, but in between.
Yeah, and we have to understand how to change it. Yeah. So, really simple. If it's draining, add something in it to dry it out. Calcium alginate, you have it. If it's in there, calcium alginate. And calcium alginate is not something that you put in there and cover and leave it alone. Calcium alginate is to put in there, suck up the wound, and then you still gotta cover it. Now, if you're dealing with a dry, there's two things. There's three things actually. And in this situation, there's two things. There's dry wounds and wet wounds. That's all you need to remember as a med tech. You look at it, I come in and I'm like, man, the dressing fell off. And it's like a dry wound. And you look at the order, and you look at all this dressing, and the order says do this and do that. So the first thing is probably going to tell you to clean it, right? If there's no wound cleanser, again, go back to this. It's the best you can use, okay? And the reason why is because wound cleanser, when you're dealing with a wet wound and you're adding more stuff on there, it's not the same as your plasma. That wound can suck up all of that nutrients from the wound cleanser, and that's going to be even more draining. So that's why this is so important. Anyways, you come in as a med tech and you just like came off and we're gonna do this. You look at the order, it says, clean it with wound cleanser. I don't have a wound cleanser, and then put calcium alginate and then cover with foam, right? So that's what it is. You just clean it this. And again, when you in that situation, when you're cleaning a wound, just clean it and squirt it. Don't even dab it, because when you start dabbing it and it's already healing, you're removing all these nice tissue in there. But before we used to say dab and dry it, right? And that's always been. But the new tissue that are healing, when you start to dab it, you're removing it. So it prevents it from, it prolongs healing, right? So, but if you really think about it, you're squirting and cleaning it with this wound cleanser, just squirt it gently. If it's a dry wound, you need that moisture anyway, right? If it's a wet wound, it's okay because you're gonna put calcium alginate in there to suck up all the moisture anyway. And then put calcium alginate, cover it, that'll turn into a gel. If you notice that, hey, hospice only comes like 4 days a week, and within 24 hours, this dressing is already wet, they have to change it more frequently. Because that wound is never going to heal if it sits there wet. It's called a strike through. It's striking through the dressing. It's not going to heal when it's already 24 hours, it's not going to come for 2 days, it's already wet. So it's going to sit there moist for the next, it's no good. That means there's too much moisture in there and the wound doesn't have a chance to heal. Okay, so you're going to run into skin tear, you're going to run into a cut where there's no more flap. Okay, you guys know how to deal with that. You're going to run into wounds with it wet or dry. That's all you need to remember is wet and dry. Okay, everything else, call a doctor, call family members. get some orders, call hospice, get them to take care of it. But once in a while, you do have to take care of it. And all you gotta remember is like, alright, is it a wet or dry wound? What do we need to do? Just remember that the wound has to migrate. For the new cells, for the tissue has to migrate, and it needs to be moist, right? If it's too moist, I need to dry it up, or calcium alginate, right? If it's too dry, I need to add moisture. Same thing, calcium alginate, but I gotta add intrasite in there. And you guys might have intrasite. If somebody's in the hospice and they're dealing with a dry wound, they're gonna need something to get it wet, which is intrasite, right? So, very simple. And then, fragile skin, obviously use these foam or tape. Okay, if you don't have this foam and you have somebody who has fragile skin, just put a just look at what you said, the telfa, right? That's they use the tape, paper tape, right? So, but make sure that the wound is moisturized. Either use a vacitracin, you know, and then cover it.
We use all
And
that.
then tape. Yeah. So that way next time you're like, okay, I gotta take this off in a couple of days and dry. You're gonna be ripping that off and then you're gonna hurt. And again, you might run into the situation, don't freak out. Just squirt more moisture in there before you take it out. Okay? Just keep squirting it. Okay?
When you have a wound, like you said, like the open wound with no flap, and you put the layer of, what was it called?
Top dressing? This one right here?
Yes.
Yeah.
That one?
Yeah.
Don't you wanna use like a non-stick pad instead of using this, cause this will stick to that, and then it's gonna create, cause it happened to us already.
Yeah, so you wanna put either a foam on top of it
Yeah,
or a non-stick pad and then
and
cover
then
it.
cover it with,
Yeah,
with like, the non-stick pad, and then you can use that.
Right.
Or something like that, cause someone, wasn't me.
yeah. But usually typically when you put both cases, yeah. So this is, so guys, when you have this, right, take a look at this. This comes dry sometimes. This comes dry sometimes. If you just put this on top, like, yeah, it's
It's
gonna,
gonna stick.
but look at it, this is full of oil. So this is gonna help
But
you.
even though it was the one that we used, and they did that one, but ours is,
How long did you keep it there for?
a day.
Oh, okay,
And then with this,
yeah.
it,
Then you need to put add more moisture. So this on top of it, what's designed to do is that you can put the Neosporin on top.
okay,
That'll keep it moisturized.
yeah.
Okay, you guys probably don't have intrasite. Maybe you do. You guys use a lot of intrasite?
I think we have it in one of,
Okay.
or one.
If you
But
have,
I don't know.
if you run into the situation, put intrasite on top. Just put it on top and then cover it.
Okay.
That'll keep it moist. Okay, because you
It's
don't
like a gel, right?
Yeah.
Yeah.
Like a gel. So intrasite, there's another name. There's another one too, but they're all the same. They come in like little like square bottle with a pointy tip, and then or the little short one with a pointy tip. If you don't have that, you guys have Neosporin, right?
Yes.
Yeah, just put Neosporin on top of this and then cover it. Yeah, but you should, and don't change it every day if you can get it to like, but if it's sticking like that, it's just really dry.
Yeah,
You know what I mean? And you need moisture on there.
okay.
And that intrasite or Neosporin is gonna help you, right?
So what do you do in situations like that where you have something that's already stuck to the wound and you can't take it off? But that's not working.
You just squirt it and then you let it sit.
Yeah, but if it's not working,
Is that working?
yeah, if it's not working, if it's not taking it out, it's still very, very stuck to that.
Yeah. You just pull it out slowly.
Okay.
So usually sometimes too, like you can use an alcohol, kind of rub around it, or you can take a wet gauze, right? You can take a wet gauze, a lot of it, and then just put it on here and then wrap it so it can absorb the moisture and let it sit for a little bit.
Okay.
Okay, because if you just squirt it, you might just be getting the top part and it's not soaking underneath. You take a wet gauze, really damp it, and then put it on there and then kind of wrap it with this or something to keep it on there, so that way it can be moisturized.
Okay.
Okay.
So
Let
what,
it sit for like 5 minutes.
so I got another question, like, let's say you're doing a wound care and this person has like an infection, like MRSA and all that,
Yeah.
what are the,
Precautions?
yes.
Yeah, so MRSA, anything MRSA related is all contact.
Mhm.
You're not gonna breathe it in, right? Unless it's MRSA in the respiratory,
Mhm.
right? If it's in the wound, you're just thinking that it's, I have to touch it and then ingest it or put it in an open wound for me to get infected. So the most important thing is if it's in the leg, right, or in the arm, it's all contact. You gotta wear gloves and gowns. That's it. And so, and then the other part is that once you're done with that, this is where we all messed up, right? We have all this stuff on, and then now how do you remove your PPE, right? Because you have it on your hand. Obviously, you got MRSA on your hand. So you take off the dirtiest part, which is the gloves. You take it off like this, right? And we'll do PPE down in the mouth later on, but you take it off without touching anything. You rip off your gloves, right? Your gown might have some MRSA right here, so you don't want to be like going like this. So you want to touch from the top, right? The strings at the top is the ones that are clean because you never touched it, right? And you're clean. Your hands should still be clean so long as you didn't touch with dirty gloves. Take it off and then remove it, right?
Yeah.
And or you can rip it up from the front, right? And so just make sure that you just remove it like this. Or what you can do is you can take off like this with your gloves, just rip it off, and then take off your gloves at the same time. Okay, but that's really important. And then after that, you need to be washing your hands. So it's all contact related. And then this is where I want you guys to be very comfortable. Is like don't be afraid of infected wound or MRSA or any of that, because you're gonna be dealing with it all the time. If you're afraid of it, it's because you don't understand it. So, but if you know what you're dealing with, you know proper infection control, you just okay, let me handle this because I got this, and then you teach your caregiver how to do it, right? So it's all in your hand, it's all in your PPE. Remember, make sure you're removing it correctly, and then you wash your hands really nice. Okay. When you're done, if you think you got it on your high touch area like chairs and bed handles and doorknobs, then you do clean. Okay, but you should be doing that anyway if somebody has MRSA.
Yeah.
High touch areas, phones, doorknobs, side rails, right, on the bed. It's all on there. Okay. So, yeah, good question. What else?
Anything? Huh? Let's see what I come up with.
Yeah. And sometimes you see just stuff like resident skin, you're just like, what is that? Have your nurses take a look at it. You know what I mean? If it doesn't need like an emergent needs, like it's bleeding or it's painful and swelling, just tell your nurses, hey, I saw this is what's going on. Because a lot of it you can just monitor too. You might have patients that are growing tissue, right? The skin tag that are just straight up growing, and it falls off and it starts to bleed, and you do first aid, you just cover it. Or if it's dry and it's not bleeding, you just monitor it, just let it be. Okay. So, all right, guys. Any questions? You guys have questions on how to use this? Comes in smaller pieces too. So you guys could use this in here not as a wrap to bring fluids, but as a support. So for example, you have a lot of you have this that's coming off and your patient is removing it. You can wrap it around. You can use this to wrap it around it to kind of secure it, right? So you can use this as a form of secure, right? To secure the dressing. Okay. I think that's pretty much all you guys use in here anyway. Band-aids. You guys use this quite frequently.
Yeah.
I don't like to use band-aids on skin tears because band-aids come off easily, and when the band-aids come off, it's gonna rip that skin tear off. Okay. So the band-aids are kind of cheap. They don't work as good as the steri strip. So if you have skin tear, use the steri strip over band-aids. Okay, you have a tiny little cut, yeah, use a band-aid. Okay. All right, guys, make sure you sign in, and then we'll put this on the video.